Hello, and welcome back to In My Hometown. Today, Pascal and I are talking aging and confidence and good choices as we are, some of us going golden and some of us are golden and in that era. And we are sitting down with Dr. Michael Lee. He is a board certified surgeon and host of a popular podcast called I'd Love to Know, which I think is the coolest podcast. It's all about aging, both inside and out, and how that makes you feel good. And it's all about longevity. So we're so happy that you're here today with us.
Well, thanks for inviting me.
Thank you for coming on. This is super fun. So this is a great topic, and we've brought it up a bunch of times over the past many weeks. And I did a little bit of, not a lot of research, but I did a little Google search that told me that there are nearly 38 million people have undergone aesthetic procedures and this year, and that is a 42.5% increase over the past 4 years. So I wanted to talk a little bit about what are some of those most common or trendy procedures that people are having, and in particular over 50.
Yeah. Probably the most common procedure that people are having now are the eyelid surgeries. Mm-hmm. It's increased significantly over the last few years, like you mentioned. And I think social media and celebrities looking good has helped.
Right.
Okay, so let me ask you a question. We're going to jump into the one who's the most popular. What is the most popular plastic surgery that most people doing? Is not breast implant, I think? No?
Correct. So the two most popular procedures are breast augmentation and rhinoplasty.
The question I have for you is, are they doing it for themselves? They're doing it because their husband wants to? They're doing it because they get divorced and they want to have a better figures? What is the reason a woman comes up to you and said, I want my breast augmentation? Or what is the reason?
Yeah, well, for my practice, I see mostly women that are 35 to 65 or 70. So in that age group, a lot of women come in post-kids. So that typically is the most common reason people come in for breast surgery, is they've had a couple children, the breasts have changed, and they want to kind of return back to what they used to look like. All the reasons you gave are all accurate. Most of the time, people come in for that, but certainly people come in post-divorce and they want to change the way they look. I don't think I see women who typically come in because their husbands want them to come in. In fact, almost every time they come in, they say, my husband likes me the way I am, but
that's
I'd like
reassuring.
To change
that. That's reassuring.
That's very reassuring to hear.
And the husband's got a big influence on the changing the look of a woman because of the aging, and they want somebody younger, so they go do this, go do that. It's interesting.
Well, I'm glad to hear that that's not the case,
me
though,
too,
because
me
that
too,
makes me feel that there's hope for mankind.
Well, I will say this.
Okay,
Yeah.
so now we're talking about mankind, is men getting more plastic surgery these days than in the past? Are they coming up? Are they trying to have their facelift, the eyelash and stuff like that?
Yes. Most of the time, men come in typically because it's related to their job. So I see a lot of people that are CEOs or C-suite men, and they are feeling like they're competing like women with a younger generation of people. They feel great. Fitness and longevity, as we just talked about, is so popular right now. Mm-hmm. So their body's feeling great, they're feeling great, but they look in the mirror and they see someone older than how they feel.
Right.
And so they're competing with them too. So for men, a lot of times it's the upper eyelid surgery or the fat in the lower eyelids that make them look older. In fact, that's what I did this morning.
Okay, what would you do on me?
Oh my God, I would never ask.
I am perfect.
I get this question every time I go out. Every time, probably 10 times a night.
Yeah.
But no, and I
How
always
honest are you?
I always say this. You look amazing.
I know,
Pascal.
but you gotta say that.
Of course, someone would go home and be
like
very
the French
upset.
Don Johnson.
Right. But I mean, I think that is, and we're going to get to this, but we can get to it right now, is a lot of what you talk about on your podcast is that there's stuff on the inside and other things that's part of other things we can be doing that would help us to feel good. And that helps us because that's a part of looking good.
Correct.
Is that, yes.
And I always joke with people. I mean, I do plastic surgery, but I'm in the happiness business. And so a lot of that is trying to evaluate during a consultation whether this person is ultimately going to be happy with what they had done.
Right.
So there are times where you realize, in the rare instances like Pascal talked about, where it feels like it's not motivated specifically because they want to do these things. It could be because they're trying to find a husband or a date, or it could be because they have a bad marriage, or they have things that they have to work on. So those are really, really important factors in determining whether they'll ultimately be satisfied with the surgery.
And how do you evaluate that? How do you know? Like,
I mean,
just from one consultation? Or
you can kind of, there's little tricks you can find, especially, for example, like a rhinoplasty. Like we talked about, it's one of the more common surgeries. And a lot of times,
nose job.
That's a nose job. And a lot of times they come in. A lot of times they come in and I'll ask them, name 2 or 3 things that you would like to have fixed on your nose. So people who have specific concrete things, so I have a bump on my nose, I have a wide tip, or I have my nose hooks down. Those ones typically, we can at least say at the end of the surgery, we did those things. The bump's gone, the tip's straight, whatever the issue is. But every once in a while, there's a person who says, oh, I don't know. I don't like my face. I don't like my nose. And so that non-specific kind of answer sometimes indicates that there's more going on and they might not be happy with the surgery.
So from what I've seen, on social media, obviously now we all in social media, and there is those type of a series where they show the before and after. And don't you think then people are getting carried away a little bit with plastic? I think it's really become, I remember the time where the plastic surgery was like a very taboo. Nobody was talking about it. They come by the front door, they leave by the back door, they stay home for 1 week to recover. Nobody knew anything. All of a sudden, now you could see in every magazine, woman, the before and after breast implant, the before and after nose, the before and this, the before. It become a way of life, but are we getting carried away a little bit with it?
It's a great question.
Ask Jamie, I always got good question.
This is a great question. So, in fact, this is a big topic. I was just at a wedding, and this is a huge topic of conversation at the wedding. I think there are 2 parts of that. On the one hand, I think social media has created this sometimes unrealistic outcome. The other thing that also happens, and it's amazing to see in the office, is that a woman, whether it's breast augmentation, inspiration photo, or a facelift or eyelid surgery, they often will look at someone who doesn't look like them. So we have somebody that comes in that may have a different bone structure, more weight, or a larger frame, and they'll show a picture of someone with a small frame, petite body, and no fat. And so there is a disconnect with the results of what some of these celebrities are getting and what a person who doesn't look like a celebrity is going to get as their result. So a lot of that is definitely something you have to talk about in the conversation. And that is one thing that's slightly worrisome, especially for the young generation, these kids that are 15, 13, 12, and they're already using anti-aging products. You know about this?
Yeah.
I have 2 daughters.
Yeah.
So they're using anti-aging products. And so part of that is a little concerning. But the other part of it is there are ways to do these things safely and can get an improvement that makes people feel more confident. And what I often tell people is because I do plastic surgery, you might think that I'm looking for a specific outcome, like an ideal, like everyone has to look the same. But doing it so long, whether it's breast surgery or face or nose, what it actually has you do is embrace the diversity of what's normal and the beauty of diversity, both of those. And I think that is something that the longer I do it, I also find that people genuinely feel great, and I feel great helping them do those. So if something can be done safely and they have reasonable expectations and they understand that they may not look exactly like a celebrity, I think it is still something that is worthwhile for people. I could definitely see that, and you can tell that some people,
some people really need this opportunity to make themselves feel good. I also would understand that there have been a lot of innovations made. So some of these procedures that used to be much more in depth are not. Or what are? Would you agree with that? Or are there just new things that are being done? What is being done? A lot of Botox.
A lot of Botox. So there's a couple things. First of all, like Botox. If you started early, you can go through a period of never having wrinkles, which is unbelievable.
Yeah.
It does a lot of amazing things to the skin texture and quality.
When do you have to start? At 15?
So this is what you're talking about, the sliding slope of it.
Yes.
Is that I think the biggest change, which addresses some of Pascal's concerns, is that it's now being done on earlier ages. So when you're doing something at an earlier age, we do modify the type of surgeries we do. If we're doing an eyelid surgery on a younger person, we're doing a lower face neck lift on a younger person, it's a slightly different procedure. And same thing with Botox. So of course, in a woman in her 50s and 60s, they may get a certain amount of Botox. Someone in their 20s and 30s would get a smaller amount. So that's probably the biggest change, is the target audience has changed somewhat for the anti-aging things. The procedures have changed as well, but they're much more subtle. If anything, I think it's more a pendulum swing, like people get caught up in the deep plane facelift. But that was a surgery that I learned and trained in and did mostly deep planes 22 years ago, 25 years ago.
Is that what like Kris Jenner had?
No. So this is another misconception about hers, and I know you want to talk about hers.
Yes.
But I do know her plastic surgeon, actually, ironically.
We have a picture of her.
Yes.
She looks like she's 25.
So this is social media. So I don't know. You're going to post
this. Filter. This is retouch. This is lighting.
So
yeah, I mean,
her surgeon's getting a lot of love right now because I guess she just had a birthday party.
Yes.
And I know people who know him, and he flew down for this birthday party. He was very excited about it, and he was a lot of photos with the celebrities. And he's an amazing surgeon. But most of this, when you look carefully at her, if you ever look at some of her older pictures of just a year or two old, you'll see that she has textural wrinkling like a 60-something-year-old person would have, and wrinkling around the mouth. And the texture of the skin is significantly different. And in this photo, she has a great jawline, which is improved by that surgery, and a little more tightness in the cheeks, which is improved with that surgery. But you'll also see how great her skin, that's the biggest thing that I see here, her skin looks completely smooth. That is a filtered look. That is makeup and lighting. And so I have this, I see probably 4 or 5 facelift consults a day. So this is the conversation I have 4 or 5 times a day.
Wow, okay.
Kris Jenner looks so great.
Yes.
I want to have her surgery.
How long was she recovering from that surgery?
So the other thing there's so many things about this. So for Kris Jenner specifically, she's had multiple facelifts. So the thing is in an experienced surgeon's hands, the second and third facelift will give a better result and will be more long-lasting. It can go bad in some hands because if they don't know exactly how the scarring is and where it is, you can look overpulled. But in general, you can get a stronger pull, stronger jawline, and a secondary or third tertiary facelift surgery. The other thing is, so she's had multiple surgeries. The other thing she does is she does a lot of skin care and maintenance with lasers and fillers and Botox. So it is investment that she has made into her face. If you just come in doing no Botox, no filler, no laser, first facelift, and you're 65, there's just no way.
Okay, so let me. I understand that the pictures retouch and stuff like that. Yeah. But now you get a beautiful face. You take off the clothes and you get a whole body.
Oh gosh!
Am I right? No. Let's be realistic. I mean, the hand are old. I mean, let's be realistic. You know, you see a woman, she's like 20 years old, and then all of a sudden you see her in bathing suit, and she looks like she's 100 years old. So what do they do for the body, Minnie? Do you think then she does a skin tightening? Do you think she does another breast lift? Do you think she does... What does she do to make the rest of the body look as young as the face?
Well, she wears gloves a lot.
So,
that's right.
Right. You can certainly start early and start with sun care and sunscreen. But ultimately, yes, I'm sure she does her breast surgeries and her tummy tucks and her skin tightening. There's several different skin tightening procedures that you can do.
But it can't look
Yes, it
Are we
still
going
looks
too
the same.
far with that? I mean, I remember that one time the Kardashian, that was their butt, they had a big butt, and over the sudden, everybody wanted a big butt. I mean, are we pushing the plastic too far?
Well, I actually think that it comes, like I said, goes in waves. So we're actually right now at a time where a lot of the plastic surgery looks much more natural. And I think that is what's opened the door for people to become more interested in it. If you remember before, there were women that were trying to get the big butts and this sort of thing, but it was in a certain
What about the women that had
group
the
of-
big butts already?
Yes,
So maybe that
yes.
made them feel better.
Yeah.
It's so there's been a change back right now. I did a few of those. I never really did those kind of surgeries, but there's been a pendulum back now. Now people look a little bit more natural. Even the Kardashians have downsized a lot of their implants. They're not doing all
That is
so-
another trend, or what seems to be a trend, is sort of the taking out some of the fillers and some of that's gone on. I don't know. For me, Pascal, it's not so much has this all gone too far. I wonder sometimes if you get, I don't know if it's called a dysmorphia, but you almost see these women who, it's like when you get tan and you don't realize that you're tan anymore and you keep getting more tan, or you lose weight and you keep looking at yourself and you think you need to lose more weight. I think the same thing probably happens with plastic surgery, or that you keep wanting to do more and more and more.
There's a percentage of people that it happens to, for sure. The probably bigger percent of people have more of really favorable outcome. They're very, very happy. They say, hey, my neck and face look great. What about my eyes?
Yes.
What about my breasts? So they actually have a very positive experience. They feel happy with the way it looks. It was a very quick recovery, and that opens the door for them to do something else.
Yes.
But there's certainly women, typically, that lips are the perfect example. They come in, they can't even tell that they have lip filler, even though the lips are larger. And so there's a small group that are going to be susceptible to that for sure.
For sure. Now, Pascal, you keep talking about how is it too much, or asking is it too much, but yet the other week we're talking and you were in love with Demi Moore. So
I mean, you know
let's
what?
just talk about Demi Moore.
Yeah,
for a
yeah. I mean,
second.
I think Debbie Moore. I mean, I had the chance. I'm watching the
back.
show, the how you call the lensman,
Right there.
and the camera was close through her, and you could see her skin. I mean, all those pictures you see on social media, they're all filters. Okay, I mean, obviously, if you come close to her, she doesn't have that porcelain skin. She doesn't have that.
You mean she
I mean,
doesn't look like she's a baby?
No.
Okay.
No,
Well,
not
that
at
would
all.
be
But
good.
I mean, I think the filter, the makeup, and everything cover everything. I would say she looks beautiful. Okay, I mean, no doubt in my
And I
mind.
think her
that-
body matches her face.
Yeah, I mean,
probably.
you
my
could see
my
the-
guess. I mean, we've seen her naked, almost naked, in some of her movies recently.
that was a long time ago.
No, Substance. I saw it. Wait, Substance or yes, Substance. It's a
I
crazy
mean, I
movie.
think
Have you
she's
seen
done.
that?
I think she.
I saw part of it.
Oh my
What
God.
is that new procedure I see? It's like a sewing. They sew the face with like it's a.
Were you
needle.
watching Frankenstein?
No. But they seem like there is the sewing where they.
Oh,
they-
just like in the office,
Yeah.
where they just kind of push this needle up here and push the.
yeah.
It's called a thread lift.
Yeah, the thread. So what is the thread versus a facelift?
But they're big differences. The thread lift is a suture, usually an absorbable one, with little barbs on them or cones. And so when you put it underneath the skin, you can use the barb to try to push the skin higher up.
Higher up. So there is no scar on that. am
There's
I
no
right?
scar,
So
but
that's
internal scar. There's
internal scar, but you don't see it like versus a facelift. I think you got to
Right.
go to the behind the ear, and there is what we call the lower facelift and the higher facelift. Tell us a little bit about the difference between those two.
So a thread lift are these strings that I talked about, and so they're not very effective at lifting the face. They're most effective in someone who doesn't need a surgical procedure. So if somebody that comes in that may be aging quickly at 35 or 33 or 40, and they want a facelift or a lower facelift, then this is and they're obviously not a candidate for those surgeries, then this is something that can give them a little bit of improvement. If anything, a lot of these threads will actually make surgery in the future much more difficult because it will make the different planes all scarred, so it's difficult for the surgeon to find the right plane if they want to do a deep plane type surgery. So in general, we tend to discourage thread lifts for any kind of anti-aging procedure. The lower face neck lift is primarily to improve the jawline. So as we age, we get jowls, which is that softness that you get in the corners of the jawline, and then the looseness that happens in the neck. So it's a great procedure for that. There's 3 different types of ways to do that. One is plication, like you do with pants. You just basically sew the tissues over itself underneath the skin. The other is where you take a strip of that deeper tissue called the SMAS out and sew it. And the final is a deep plane facelift that has become very, very popularized. And so that's where you go underneath the SMAS tissue and lift up the tissues. And social media has done an incredible job promoting this,
Yes.
because every patient asks me, am I doing a deep plane facelift?
Yes.
And before, 5 years ago, I've been in practice over 22 years, nobody asked me. But when the last
This
year
is
or
new,
two,
am I right? This is
no,
new.
that's what I was saying. So I trained in that surgery 30 years ago.
Wow.
I think it's because of TikTok and watching some of these plastic surgeons and others talk about these procedures. And like I've heard of an upper bleph. I mean, I all these terms and procedures that I've never heard of before. Do you think that's part of it too? That it's just becoming more commonplace to talk about them?
Sure.
Yeah.
It's gotten a lot easier for me to have conversations with people, but then you have to have them slightly unlearn some of the stuff they've learned on social media. Primarily because, as I talked about before, we all look different. So you can't look at someone's before and after as your possible before and after. Right. And then to kind of talk about what surgeries can actually make a difference, which ones are more marketing, because plastic surgeons, some of them are very savvy, and so they know the right marketing terms to say, and some say, well, I've got this new procedure, it's my own, it's novel, no one's ever done it, and it's just a marketing way to describe a procedure that's commonly done. So,
If a client comes up and said, I want triple DB, and you see the frame of the woman, you say, we won't fit you. If the client insists of having that, are you doing it, or you said, no, I don't want to do it?
No.
Okay, I like that.
And do you have some images to share with us today so Pascal could look at that?
No, but I mean, some people asking.
People ask me all the
time.
When people come up into
People
my
are asking.
Yeah, and they said, I want purple, green, and yellow hair. Could you do that? I said, no, I'm not going to do that because I don't want that to leave my door and represent who I am.
Correct.
So some people, you see, they have a huge breast or they have a very tight facelift, and I just think then it get carried away personally.
So that's what I say in my consults. So yes, I turn people down all the time for surgeries. And because at the end of the day, I want to make sure that what I can deliver is something that they'll be happy with. So a lot of times they'll have an unreasonable expectation and no one can deliver what they want. And other times, like you said, they will deliver a result that I don't want associated with what I do. And finally, there are some times where it's such an extreme, you can actually have complications, and I don't want to be dealing with those as well.
Right.
So.
Are you doing as many breast reductions as you are breast augmentations, or no?
Well, we have this saying, the law of breast mass stays the same in the world.
Okay.
There's reductions and there's augmentations,
Right.
but
Yes,
it's
both,
the breast mass of the world stays
That's
the same.
hysterical. That's hysterical.
But no, I mean, I have a different type of practice. I don't really do medical reductions and things, but I certainly do breast reductions. I think women are very, very happy with them. It's one of the most rewarding surgeries because a lot of times it could be young women that are very self-conscious about it or trying to exercise, and it's obviously out of
But do they
proportion.
do it at one time? I've seen that where they go underneath the armpit to put the implant. There is no scar. Some of them goes around the nipple to put the implant. So goes underneath the breast. What is the best procedure to have the best result? Who look very natural.
Okay, so Pascal is
See, I got-
perseverating on breast
We are usually
augmentation,
focused
breast
on this.
reduction.
I'm ready to-
I just want to comment on that.
Okay.
But anyways, on the
I'm
augmentation.
also ready to move on, but let's keep going. Okay.
On the augmentation, I would say it depends on the shape of the breast. In general, most of the incisions are placed underneath the breast, like in the crease, because that's the one with the least amount of complications, more likely to put an implant in the correct position. When you go through the areola, it leaves a very little to no scar, but sometimes women have very small areola and it's hard to get an implant through that. The armpit, and then certainly it can also affect breast sensation and increase the risk of firmness in the implant. The armpit one, I have never loved. I mean, certainly there are surgeons who can do an excellent job placing it through that, but I think that has the highest revision rate the implants end up looking closer to the armpit because that's the place where you came in. And secondly, if you need a revision, it's very difficult to go back through the armpit. So most women will likely have 2 incisions just to save themselves the one.
Okay.
So.
I want to go back to, we had a couple more celebrity pictures that I just wanted you to react to. One is, so Brad Pitt, we didn't want to only talk about the ladies, but we have a Brad Pitt picture, sort of a before and after, and he looks amazing. And it looks subtle.
Yes. So this is a classic example of a great lower face neck lift, also by Steve Levine, just so you know.
Oh, really? Okay, he's the
Who
guy.
did that?
The same guy who did
Debbie Moore?
Kris
Kris Jenner?
Jenner.
Okay.
I think.
Yeah,
It's reported.
okay.
I mean, it's reported.
Okay.
But ultimately, it's a great result. I think this is the perfect person to come into my office. You know,
Yes.
if you have a really square jaw, as you can see in Brad Pitt's older photo,
Yes.
and most of it's just looseness in the skin. He doesn't have a lot of heaviness underneath his neck. He doesn't have large glands. He obviously has a great bone structure. So yes, this is what a great facelift can do.
Right.
And then the other thing he has, which people are very afraid of, but more and more plastic surgeons are doing this, is fat grafting or Sculptra or some kind of filler in his face. So what happens is all those wrinkles that you see in that kind of cheek area, lower cheek area, you can smooth it with pulling the skin, but someone has subtly placed some volume in the hollows of the cheek here, and that really helps with the wrinkling that you might have in that area, even after a surgery.
Right.
So that's the
I personally
key.
think he looks better before than after.
Oh, really? I think he
Yeah, I
looks,
mean, I like that masculinity. I think you know, he looks a little bit more ragged. Over there, he's too tight. You know,
I mean, you know, the picture that I don't have up today, because I didn't want to get too many of these, but is the actor who was in A Star Is Born.
Oh, Bradley Cooper.
Bradley
Yeah.
Cooper.
People are saying that he looks like Barry Manilow right now.
That's so mean.
I know, so
well,
mean.
I could just
He doesn't
tell you
look
this.
like himself.
So I think that the issue with that, I do a lot of eyelids.
Yes.
Like I said, I just did one today. Brad Pitt had his upper eyelids done here, and it makes a big difference because there's so much skin hanging over it. He looks kind of sleepy or sad with his eyes in the top photo, or the left photo. The thing about men and upper eyelid surgery, if the incision is placed a little too high, which I think was in his case, and there is fat removed from it, which is, I think, in his case, then it can be feminizing for the upper eyelids. So you have to keep the volume full in the upper eyelids if that's what they
I'll
started.
show you a picture later, Pascal.
And then you have
Bradley
Bradley
Cooper.
Cooper.
I
you
didn't
have
know
to
that one.
keep the crease small. So if you see Pascal, very handsome individual.
Yes.
But you
Don't
see-
tell him that, but he knows
But you,
it.
I know.
but you're French?
Yes,
Okay.
oui.
Is that you see how his crease is very short. You don't see much of it. If you were to all of a sudden make it very high, raise your eyelids really high. See what it looks like? So you have to be very careful about not making the volume in a man up there too not enough fat in there and having the crease too high. It looks feminine and it kind of looks unusual. A more masculine look is kind of what he has, where the eyebrow is very close to the eyelids and he has just a small crease.
Yeah.
I would say that I could make him a little bit better looking.
I am sure.
It's pretty hard. It's pretty hard, but I believe you.
I love it. So, and then we had a couple others. Madonna, I think, was in there, and you know,
About Madonna. About
So
Madonna.
this is such a horrible photo because
and I love
what
Madonna.
Well, if you see her now, she looks much better.
She does.
And the thing is that when you have pan facial fat grafting, which is probably what she had in the right photo, it's quite unusual looking. And I guess kudos to her for going out when she probably should have stayed home.
I see. So it sort of fell, or it.
Yeah,
it was
when
like
you put fat, I mean, I'm condoning this level of
Yes.
fat grafting. This is crazy. But in the end, when you have a procedure like fat grafting to so many areas, it is swollen for a long time, a few months at least. And then the fat grafting, a good portion of it actually doesn't survive. So you got 30% go away with just not surviving, probably 50% larger than it had to be. But if you look at her probably 6 months or a year later, she probably looks much better.
Yes.
Not that I would do this. This is even if it ends up with the results that she has now, which she looks okay now, right? She doesn't look 65 or whatever age she is. But I think in general, yes, it depending on what time you take them. I mean, Nicole Kidman's another example. She
Yes.
does so many movies. When she recently has a procedure, she looks very unusual. Like the mouth doesn't move right. There's pulling. And then over time, it does settle.
Yeah.
For my patients, though, nobody wants that look. And I usually counsel them and talk about, hey, you're not gonna end up with no wrinkles. You're not gonna end up with a jawline that's way artificial for your age. You're gonna have a few wrinkles, but what it means is you'll recover quicker, you'll look more natural, you'll look rested, but you won't look like you've had surgery. A lot of these people, you clearly know they did. They look great.
Yeah.
But
Like
it's a
Lindsay
different-
Lohan is the other one. I mean, this is a young woman who I think she's, oh, okay, we don't have the
But
Lindsay
I've seen
Lohan's
photos.
35. I think Anne Hathaway maybe is 40. They're
45 or
all- oh, is she 45? Okay.
I only know this again from my patients.
Yes,
I don't
but
follow
they seem
any
to
of
be
them.
undergoing, significant surgeries.
You know, I don't know what Lindsay Lohan did. I'm sure it looks. I mean, I don't follow the photos, so just take us all with a grain of salt. Her eyes do look better, so it's possibly she did her eyes. But in general, what I can see of her is that she looks like she's lost weight. She's a lot healthier. My understanding is she probably had some drug problem. I don't know.
Yes.
Addiction
She had a-
problem.
Right.
And
she
so,
smoked,
like
she
cleaning
smoked
up
a lot,
and
so maybe not smoking
health-wise.
anymore.
I mean, there are a
Yeah.
lot of reasons that people could look better. You know,
Right. And that's what some of what you talk about in your podcast and other things that these are other contributing factors. So what
Yeah.
can we be doing?
Yes.
What should we be doing? What are the do's and don'ts that will help us age more gracefully?
well, there's two parts of that. So, like,
okay.
I will say this: people have come up to me in the last year or two and say to me, "Oh, you look great. You're looking young. You're looking great." And I mean, a lot of that has to do with eating healthier, exercising more, sleeping better.
And water.
And drinking less alcohol. So I would say in the beginning, what I would say is start with your foundation, which is going to be sleep, not eating packaged processed foods, and weightlifting. You start with those can go a long way. Cut down on alcohol, don't get too much sun. But yes, I mean, from plastic surgery standpoint, after that, then I would say for people that get into their 50s, if they haven't started Botox really will help improve the quality of skin that you have. It's like a gimme, and it will really improve the texture, the aging of it, obviously the wrinkling, and it can actually make you look better if we put it strategically to raise the eyebrows or to help some people with a very active mouth or neck. So it's used in all areas of the face. I mean, it's...
So let me ask you a question. You said earlier that you've been in the plastic in that industry for the last 30 years. Okay, so you were there pre-internet, social media, and stuff like that. Do you think that your business has shifted since we have that internet, we have that social media, we have that TikTok? Do you see more people coming up and wanted plastic surgery to enhance their look because of the influence of social media? Pre-social media, what is the difference? And when you started to where we are now, it's a big difference. I mean, everybody is doing plastic because of the social media, because the pressure of society to look young and beautiful and sexy. Am I right?
Nothing new. It was nothing new under the sun, is whatever the phrase is, right? So I would say the desire to look good has been since the beginning of time. And babies who aren't socialized, who can't speak, well, their eyes will attract a more attractive, youthful person without anyone telling them anything, without showing them pictures in magazines. So that is an innate understanding that we have when we're born, is what makes someone beautiful or attractive. Now, that being said, social media preys upon that, right?
Yeah.
So this is something that Egyptians were doing with the charcoal on their eyelids and foot binding and everything, since the beginning of time. But yes, social media has preyed on that desire and that wish and that feeling to be attractive or beautiful. So, and as we have already discussed, we can talk about the worries or the concerns about being too focused on that, for sure. And I hope and think that this is a pendulum that's swinging. I certainly think it has swung, because 10 years ago when I was in practice, I was the only one putting in small implants. I typically put in 200cc, 150cc implants, and everyone was putting in 400 or 500. Now that pendulum has swung. I used to have a phrase called the ballerina boob. And I just saw that in TikTok recently,
Oh,
but I've been
really?
talking about that
What
for
is
15
that-
years.
What is
Just
that?
like a
Just
li-
that perfect.
It's just a small little implant that basically, I always ask people, hey, are you doing this for what shape do you want? Do you want this to look good with just in a swimsuit, no top on for your partner or yourself, or do you want it proportional in a and kind of a dress shirt, or do you want to be able to see it in a sweater? And those are three different types of profiles. But in the past, almost nobody wanted a small one. They would say, well, I'm not going to spend all that money to get something that no one else can see, or just a few people see.
Right.
I just want to, and that's the same with facelifts. It's like, I just want one facelift when I'm 70 and with just one time.
Right.
The pendulum swung at that. So I do have people that come in for facelifts in their 30s. I had someone fly in from New York that was probably 38. And I think that what we have to do is look at what we can deliver for people, but also about the expectations. But I do believe that the pendulum will swing back, because just as much as we have things on plastic surgery and our appearances and superficial looks, there's a lot of social media on working on yourself, self-help, mental health, all these other things that are out there too. And I think the information's out there, and the people that are more susceptible for a variety of different reasons, that does bring them in.
Yeah,
But I think it will change.
Yeah.
Yeah, a lot of factors is what you're
Yes.
saying that are at play and that
Yes.
are part of that. I'm going to go back to the breasts. I don't know why we keep going back, because now I have a question about
Sure.
it. What do you say about this idea of wearing a bra when you're younger? Does that help to avoid sort of the droopy, the sagginess?
So it depends on what kind of breasts you have.
Okay.
So if you have ballerina boobs,
Yes.
it doesn't matter,
Right.
right? Because the weight of the breast and the type of skin you have also plays a role. But yes, if you have breasts that typically have a natural hang to them,
Yes.
having support for the breasts when you sleep specifically,
Right, that's what I mean.
or exercise, having good support if you're a big runner or jumping a lot, and having good support will really help the tissue.
And what's your take on breastfeeding and sagginess? Does that have the impact that some people think it does?
It does. Okay. So I mean, I don't want.
Yes.
So,
No,
I
we
mean,
don't want anyone coming after anyone.
I know.
But yeah.
I mean, so there's obviously great things about getting breast milk for
Yes,
immune status for the kids, and a lot of other great things for development. But if you're breastfeeding for a long time and there is a major change in size, then it can stretch the tissues.
Right.
But everyone's so different. These are hard questions, because it really also depends on how big the breast gets, how small it gets, how much is breast tissue, and how loose the skin is. Some people's skin stretches back very quickly after having 2, 3, 4 kids, no stretch marks. Others develop stretch marks and loose skin with one child.
Right.
So it really depends on a lot of factors.
What's your take on this whole red light therapy that everyone's doing? Even my
people love
daughters
it.
were talking about it.
Everybody-
They
yeah,
go
my
to red
daughters.
light therapy.
Red light therapy, a cold plunge.
Yes.
That's what
all
Zoe,
those-
my daughter, just did.
Oxygen.
Yes.
The oxygen. What is all that exactly?
Yes.
So-
they
Should I get a
they
red
don't
light
call it, They don't
mask?
call it medical spa anymore. They call it wellness center.
Yes.
Correct.
Yes. So what is the difference of that, like Jamie said, the red light, the cold
As I hold
plunge?
my chin up.
What is all that? Yeah.
I'm just joking.
So this is all merging into kind of a lot of the stuff I do. That's why I have the podcast. That's my practice does start to kind of merge a lot of these longevity concepts. So addressing them real quickly, the red light therapy has been shown to help with inflammation, mitochondrial function. It can help with a little redness and some deeper red light. It's called infrared light, so it's a different wavelength, can help with collagen remodeling. The thing is all those studies are done with a higher wattage than your consumer product.
Oh.
Okay, so now there aren't any studies that suggest that the consumer product at a lower wattage is able to deliver that type of improvement. But and I have I have a professional grade LED system in my office. But the distance between where that starts is probably 6 inches away. And when you get these Omnilux masks, they're really right on your face. So it's not really an apples to apples comparison. I don't think we know the answer. It's promising. The problem with a lot of this longevity stuff is everybody wants something that's easy, relatively cheap. And what's happening is that people who have just a smoke of possible improvement, they're taking advantage and making millions and millions of dollars on some of this stuff. Now, is it likely that it helps? It's possible, but it's still, there's no data that says it
I had
does.
a friend of mine who just installed a red light, and he had the electrician to come up and put a 240 watt volt to be able to do that. And he lay there, and he comes up and he said to me after 2-3 sessions, he said, "No, I feel good. I feel good about myself. I feel rested. I feel positive." So is that really true?
I will-
It's more mental.
I will give you I always give this example for
Placebo
everything.
effect.
Huh?
So this is exactly right, the placebo effect. So he could. I mean, the problem is it's just there's a paucity of data. But I would say this is the perfect thing because most people have done Botox. I assume that you two have.
Yes,
but
I have
of
not.
course.
I have not.
I've done Botox.
Okay.
Yeah.
There's nothing wrong with it. I
Yes.
have anxiety. I would
Yes,
not. I think
exactly.
I would have.
So the thing is Botox really works. For most people, it
It
works.
does.
There's a 5% of people that are non-responders, but it really works. But I always point to this for the perfect placebo effect.
Okay.
So when the study was originally done, at least at Northwestern, I was one of the first people to inject it there because it was brand new 28 years ago.
28 years ago, yeah.
And so for cosmetic reasons. But when you look at the study, they had to show a 2-grade improvement in the response to get it FDA approved. But if you look carefully at it, they had 20 to 30% positive improvement in people who got the placebo. In other words, people who got water injected really felt like they looked better. 2 grades.
Wow.
So that's 30% of people. That's 1 in 3 think they look better.
Yeah.
So I always use that as a perfect example. It's not to say that there's anything, maybe it is helping your friend, but, and I see this a lot with NED+. So there are some, like, for example, red light therapy does have data. It's in the Laser and Light journal. If you listen to one of my podcasts, I talk about it with one of the experts in laser. But I think that, and in fact, cold plunge can be very effective for
Skin, am I right? That's tighten
well,
the skin to
For circulation.
for
I thought.
circulation, blood circulation. Am I right?
Yeah, I mean, it can help with injuries to some degree. The thing it's been very helpful for, honestly, has been for mental issues, depression, and anxiety. There's several studies that show that people can go longer and feel better even weeks after having a long cold plunge. Whether it helps with overall longevity or brown fat, which is metabolism, that's questionable because it's hard. A lot of these studies with cold plunge and infrared sauna, they're done in the Scandinavian countries. They eat so much healthier, they're much more active, and they try to decrease their processed foods. So it's difficult to know how much of it for their cardiovascular improvement is related to the infrared or the cold plunge and how much related to how healthy a lot of these people are. If you're going to go in a sauna 5 times a week, you can probably bet that you're going to be exercising, you're going to be trying to eat healthy. You're not just going to do cold plunge and eat McDonald's every day.
Yeah,
Most
I
people
mean,
don't.
you think here in America we have tendency to eat too much nonsense garbage, and
Yeah.
that's why we have that obesity in America.
Yeah, I mean, I think it's a variety of things. I think there's 2 major things. There's a predominance of processed foods, sugars, and decreased activity. And then I think that there's probably some degree of there's a growing amount of mental depression, anxiety, and not enough sleep. And when you have any of those issues, as we all have, like gotten really tired, I had a hard day, you're not going to bust out with a salad and grilled chicken if you're just like really, really tired and you're eating dinner at 10 when you should be eating at 6, right?
Yeah.
I mean, most people aren't. They're breaking out some wine or they're eating something a little less healthy. So when we're tired, we're overworked, if we're depressed and we have anxiety, we tend to eat much, much worse. So, but ultimately, yes, I think that part of the issue is certainly, our diet for sure.
Yeah, that's interesting. My daughter recently bought these Lemmy gummies, and they're help with debloating, and there's one that's helps with vagina like smelling better. I don't know, like all of these different areas of this.
I mean,
Do you have any
But
opinions on
she-
that?
I'm not
One
going to give
helps
my
your-
opinion on that.
Helps your breast
Okay.
bigger. No. So the debloat one she got, and she's been taking it, and she feels like it's helped. And I
Yeah.
often wonder if it's really even, does it have that much in there to be able to help, or is it she just feeling that way?
I mean, it may have probiotics.
Yes.
So probiotics go a long way into to feeling better.
That. So there's probably something in there. Okay.
I mean, I think what you're saying is like, people are bending down to pick up pennies for dollars, right? So like the red light therapy, if you're doing that, but like I said, eating McDonald's every day, then or if you're not exercising at all, again, I think the three main things are going to be sleep, your diet, and weightlifting.
Yes.
You do those things, you'll actually look better for sure.
That's what I do.
That's what you do.
Yes,
and
those three things.
Yeah.
And when you agreed to, I saw on 60 Minutes a couple weeks back, there was a doctor on there about a longevity doctor. I think it's Dr. Atani or Atia, thank you. And he was talking about how you really, if you want to be this way at 80, you got to be thinking about things at 50. You can't be thinking about it at the time. And so really that's what this theme is do now for yourself so that you will later be in a better position.
I mean, you got to start young. I mean, I think working out, eating properly,
turn the clock back now.
It's a lifestyle you have to choose at a young age. You can't say at 45 years old, I'm going to watch my diet. I'm going to start working out. I'm going to stop my wine drinking. When you're in the habit, it's sometimes you got to start in a young age. I believe very strongly in that. My son, for example, is 23 years old. He works out every single day. Right. He eats his 2,000 calories a day, and he's got that positive attitude and stuff like that. So.
And he has you as a dad.
And he has me as a dad, so he doesn't have much pressure.
Right. But you don't drink. I think the alcohol piece is big.
Alcohol is big.
In aging you. 100%. I wish I could get rid of the alcohol.
But let me ask you another question. I think I believe very strongly that the mind is control the body. I think if you have a positive attitude, outlook of life, I think you 100%. Keep younger. I think if you worry about everything, it'll age you. And that's 100%. when you worry about this, worry about that, you put in a lot of stress in your mind, and your mind age with it. I think to me is positive.
So what
attitude.
Do you do to avoid
positive
the
attitude? Be happy, enjoy every day. Live today like it's your last day. Don't worry about tomorrow because there is nothing you can do, and don't think about yesterday because there is nothing you can do. Learn from yesterday, live the moment, and see what happened tomorrow.
Yes,
I think
I agree with that. I mean, I would second that.
I love it. You need to spend a couple minutes in my house.
Yeah, I mean that's true. I mean, enjoy the moment.
I will say this for surgery. So I will second that to the 100th degree. I mean, that's how I live my life as well. And I think that people who come into my office who are worried about every little complication happening seem to be the ones where those complications happen. The people who don't worry, they fly through these difficult surgeries like no one's business. It's fascinating. I agree to some degree for sure. The positive attitude can certainly affect at least surgery.
Yeah. All right. Well, I think that we should take that to heart. And,
positive attitude. That's what it's all about.
I try.
And people want to be around positive people.
Exactly.
Yes,
that's the other thing.
Sure.
But you have two choices when you wake up in the morning, to be in a good mood or a bad mood. It's up to you. I wake up in the morning and say, hey, I'm going to have a great day today. And I go about my days. Don't get me wrong. I do have my issue and do have my problem, but I don't let my problem and issue make an impression to my mood.
Right.
I think to me, I believe very strongly that enjoy life, enjoy the moment, and then you feel better, younger.
Yeah.
Put some exercise into it, put some diet, and have good dinners and good friends. I think.
And then maybe a little plastic surgery.
Well, certainly with you. I mean, so what do you recommend in terms of someone finding a doctor? How do we make sure that you find the right
doctor?
one?
Yes.
Yeah, I think this is...
Other than you, of course.
Of course.
I think this is something that people definitely should know. So there's not a huge amount of regulation for the cosmetic business. So there are some regulations with, like, if you want to buy lasers or Botox, you have to be an MD. But a lot of the MDs are not in plastic surgery or dermatology. They can be in any field where they just say, hey, I want a side business where I can make a little bit more money. And then to add to that, you can have medical spas where these doctors are the managing doctors of the spa, but they're never around. So, and then they might not even be trained. They're not around. So I think the number one thing when you're looking at someone for plastic surgery is to look at their credentials. see where they trained. Are they board certified? If they're board certified in plastic surgery, it will say board certified in plastic surgery, not cosmetic surgery, not, there's so many different names now that people come up with their own boards and stuff. Now, there are two other fields that can kind of parlay into plastic surgery. So ophthalmologists, they can do 1 year of training after ophthalmology, and then they can be board certified in oculoplastics. So they often will say, I'm a plastic surgeon of the eyes. And so and then the other one is there are ENTs that obviously work on the head and neck, and they can do a fellowship in facial plastics. And so you will see those boards, board certified in oculoplastics, board certified in facial plastics, and board certified in plastic surgery. And then finally, where they are affiliated for their hospital. If they're affiliated with a hospital, you want that hospital to be in good standing because they will be the ones to make sure you're not having board issues. They'll kick you off they'll take away your privileges if you've had bad lawsuits, if you have issues with the board. So if you just open up a shingle and you say, and you're an MD, I can just write a shingle that says cosmetic surgeon and have a beautiful marble-laden practice somewhere and say I'm a plastic surgeon. So there aren't a lot of regulations. There's gone back and forth on why this is, but ultimately find the credentials, find someone who's board certified. And then when you find someone board certified, you also want to find someone who's experienced in the areas that you're looking at. And finally, what kind of interaction you have with that person. Is that person saying, it's going to be perfect, you're going to look perfect? I never say you're going to look perfect because you're not going to be perfect. So you got to get a different type of, find out what type of bedside manner you're going.
So there is a lot of plastic surgeons these days. Are you specialized in the whole body, or you practice specialize an athlete on low facelift? What is I don't like the jack of all trades.
Yes.
Okay. I don't like the guy who said I could do you Botox, I could this, I could that, I could do everything. I like the guy who special. Like if I have any problem, I go to a guy who specializes on knees. Shoulder, go to a guy special on shoulder. Heart, same time. So is the plastic surgery practice you have, or most of them are specializing in what are you known for? What is your masterpiece you're doing? And what make you as a plastic surgeon?
That's a great question. I think it's the approach that I've talked about. I mostly see women that are probably 35 to 75. And in that age group, it's mostly eyelid surgeries and facelifts. I do certainly breast lifts because women have had children. I'll do occasional breast reduction, some breast augmentation. And I occasionally get people that are daughters of the group of patients that I see. So occasionally I will do some of these other surgeries. The surgeries I probably do the most are eyelid surgeries. I do a lot of upper and lower eyelid surgeries, but I certainly do a lot of facelifts. We're booked out 4 or 5 months in facelifts. So I do a lot of those facial types of surgeries, but I am a plastic surgeon. So I can do all the other.
Okay.
This has been so interesting. I would love to I had a couple of rapid fire questions just to ask you.
Sure.
I thought we could end on. First, have you ever watched Nip Tuck?
Yes.
Okay. And did you like it?
I liked it because it was fun. It was a fun show. And I did get to meet the guy that invented that show. But yes. I think it's a super fun show, but obviously not very realistic. Yeah.
Okay. Most overrated procedure?
Well, that's a good one. Most overrated procedure.
Breast implant?
It all comes back to the breast implant.
Definitely not overrated.
Okay, not overrated. Okay.
Probably the cat eye. Have you heard of this? The cat eye. Someone asked me about this the other day. Like,
I've seen a lot of people that have become that look like they're.
I think it looks funny. It's actually not easy to do, and surprisingly, I probably had 2 or 3 people ask me in the last few months.
It's
younger women.
How about the reverse smile?
Is that reverse smile as the smile goes up?
Yeah, the reverse smile. Like when people smile, they like that, but there is a procedure, I believe, then they could lift it, like a little bit, no?
Yeah, I mean, I think that happens with facelifts, but I don't think that's a good look. I don't think that's what I'm never trying to accomplish that.
Okay, because I've seen people who had that.
Yes, and it looks so funny.
Most underrated procedure.
Oh no, I gotta say, very common overrated. That's social media just came to mind is the lip lift.
The lip lift.
Have you heard of this?
No.
Oh God, it's so popular on
Yes.
Oh, because so many. Yes.
My daughter's yelling over that she wants one.
So because you've seen on social media, right? And there's a guy in LA that posts a lot on this. And so I get this question a lot too.
Okay.
It's overrated. Now, some people, they're good candidates for it, but most people are not good candidates for that procedure.
Okay. Most underrated procedure.
Eyelids. yeah. I mean, it's a great procedure, but I would say eyelids. You know, it's funny. It's that's the one procedure that almost everyone can benefit as you get into your 40s. It's just that people are afraid. They're afraid of the pain. They're afraid of cutting. And they think it's very costly, but it's actually not bad. And almost everyone can benefit from that.
Except for Bradley Cooper.
If it's done right.
If it's done right. Celebs whose plastic surgery you respect or what you think, you know, is just great.
Well, like you've mentioned, I mean,
I
I think Dr. Levine is a great doctor. And like I said, I've had the opportunity to kind of talk to him and get to know him. He's a great guy and very humble. Good. I'm glad he's doing better.
Good. Okay. One thing everyone should start doing at 50.
At 50, is it plastic surgery related?
Oh, it could be any. Let's leave
Anything.
it open for you. Yeah.
Anything.
I mean, like Pascal said, like the foundational health stuff, hopefully before 50.
Okay. Right.
And Botox, hopefully before 50. But if not, I would say probably Botox.
Okay.
I'm trying to think. Yeah,
This is
probably.
good.
That's probably
And then
it.
one thing everyone should stop doing at 50, maybe. I don't know if that's.
Stop doing it 50.
Fillers, maybe?
No, so I mean, we didn't spend any time talking about fillers, but unfortunately, fillers have gotten villainized over the last year because people.
Well, we had that Courtney Cox
Yes.
picture. I'm not sure we showed that, but
Yes. I think it's the pendulum that we talked about, right? So it got overdone, and now everyone's looking at that and saying, you know, don't get any fillers. Fillers are so helpful, and they're very complementary to surgery. So I spent a lot of time trying to talk to people like it's not like what you might think. Localized area. It's made of a product. A patient just told me the other day, is like, I really feel like Botox is more natural than filler. And I laughed because technically Botox is literally a poison. It's a toxin.
Oh.
But we're able to manufacture it and put it in a way that slightly weakens its effect, and so it weakens the muscle, and that's what prevents that.
But is
But
Botox
filler is really made of a material that's naturally in your body. So the irony of it is hyaluronic acid is natural, botulinum is not. Now, they're both bad if it's done wrong, and they're both great if they're done right.
I use hyaluronic,
So-
in the
so
creams, hyaluronic acid.
Is Botox what was discovered by mistake?
Yes. So actually, Botox for medical reasons have been used since the 60s.
Yes.
So it's been used for cerebral palsy and a variety of when babies are born and their heads are cocked because the muscle is very tight, then you use it to or cerebral palsy when the hand gets very cramped.
Yeah.
So, but it was found by mistake.
Found by mistake, yeah. Okay.
Okay. All right. And last rapid fire is there any geographic trends? So, you're here in Chicago versus what's being done. I mean, LA maybe is not always good to look at, but you do see some differences.
Yes. I think one, there's more people doing it in LA. Two, yes, they look much more unnatural. There's a different aesthetic in LA. In Chicago, it's much more conservative. Not only the look, but just the general number of people who get it. People are more worried about looking like the people in LA.
Right, looking like we've gotten something done. Yeah. Great. Wow, we had such a wonderful conversation with you. Pascal's got your number on his phone now.
I'll see you.
I don't need much. He said I don't need much, okay? But I'll send you clients who need breast implantation. Okay? But I think that was very interesting. I think our audience really enjoy to know a little bit more about the plastic and what the effect and to
check out your podcast. I'd love to know.
Yeah, thanks.
And just thank you so much for being here.
Thanks for having me.
Thank you for being in our hometown. We'll see you soon.